Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. My name is Jamilah. I will represent the presentation of an article about Makassar citizens' attitude toward the pandemic, COVID-19 and health workers, that written by Damayanti from Department of Psychology, Ilhamsyah Department of Mathematics, Jamilah, myself from Department of Biology Education, and Taufiq Mathar from Library Science Department. We are all from Universitas Islam Negeri Alauddin Makassar. So as we know, at early time, coronavirus spread globally and became pandemic. It was reached million cases with thousands were deaths. In Indonesia on August 12, 2020, the case had reached hundreds of thousands people and there were almost 6,000 deaths. COVID-19 has influenced many aspects of life like economic, political, social, health, education, and so on. This challenge is directly or indirectly related to the information obtained. There are several issues related to the COVID-19, such as medical personnel manipulating the cause of death and taking advantage during the pandemic. As reported one of national media, the forced taking of the dead bodies of the patient under surveillance by their family has occurred several times in the hospital in Makassar. This is because the family believed that the patient was not contracted by COVID-19 virus because when the patient admitted to the hospital, they were undiagnosed with but another disease. Such a situation has resulted in citizens' distrust toward the medical personnel at the hospital. Another issue was many citizens in Indonesia refused to carry out rapid tests. One national media reported that there were 3 cases of refusal of rapid tests in Ambon, NTT, and Makassar. 3 factors have led to the refusing rapid tests, like consumed by hoax news, lack of socialization of media personnel to the public, and lack of trust from citizens in medical personnel. So based from the problems above, a valid and trustworthy source of information from the public indeed very important for health workers. This negative attitude can lead to the inadequate effort to prevent the spread of COVID-19. So the research questions in this article were, what is the attitude of Makassar citizens toward their health workers and which information the citizens mostly trusted? There are 2 points in article review. The first one is attitude and the second one is information. As we know that attitude, according to Multi-Ningsi, is a person's tendency to act or behave. One expert said that attitude is a complex construction consisting 3 dimensions like cognitive, affective, and cognitive. Attitude is a person's internal reaction which is influenced by various factors like personal experience, cultures, religion, and emotional factors. The second point in this study is information. As we know that information is the data that is processed into an informative form, more useful and more meaningful for those who receive it, which contain records of observed phenomena or decisions made. Besides, mass media, as a source of information, have also influenced in forming people's opinion and beliefs. The information can direct someone's opinion. The existence of new information about something provides a new cognitive base for the formation's attitudes. According to Asrafi Rizi and Kazempour, several types of information emerged and were published during the pandemic, like valid information, entertaining information, confusing information, misinformation, disinformation, shocking information, contradictory information, doubtful information, progressive information, and confidential information. From the descriptive above, one of the causes that can shape person's attitude toward an object is information, whether it's a positive or negative attitude. This study surveyed 1,000 respondents selected by using multi-stage random sampling across all sub-districts in Makassar. The survey was conducted from 4th June to 3rd July 2020. The respondents' age was 17 years and over or already married. The data were obtained through interview with the help of questionnaire instruments containing closed questions that were asked face-to-face. There were 50 surveyors involved, and the data were analyzed using descriptive statistics, This stratification has randomly drawn sub-districts with as many as 50 sub-districts. In each sub-district, 5 neighborhoods were taken randomly and 4 households were randomly taken for each neighborhood. The interviewer then went to 20 families who had been taken randomly. For each family, 1 respondent was taken to be interviewed. The selection of 1 respondent in each family was carried out by final randomization using a KISS grid random card, so that a total of 1,000 respondents. Based on the result of the study, it is known that 8.9% of the people strongly reject, 27.3% reject, and 20.6% uncertain. So 27.3% of respondents who refuse health workers are more females, aged from 41 to 60, unemployment or college student or housewife category. It is also known that the most trusted information came from TV or radio. So based on the level of the education, it seems that the higher the level of education, the more accepting the citizens toward the health workers' action. And conversely, the lower of education, level of education, it indicates that the more citizens reject the health workers. So actually, the health workers have an important role in stopping the chain of transmission of COVID-19. So the distrust that attack the public towards the health workers is a big risk that must be experienced by health workers. So one fact in interview process, the citizens reject volunteers or the surveyors because they consider them as part of the health worker. Another discussed in this article is people are afraid of rapid tests because they are unsure and do not believe the tests are valid. They fear if the result is positive, then they are isolated or ostracized. And they also consider that the rapid test is inefficient and inaccurate and not related to the coronavirus. They also fear of catching COVID-19 from health facilities and personnel, and they believe that many of the test results are manipulated. So based on the interview, revealed that the public thought that the health workers have manipulated the result of the rapid COVID-19 test. The public speculative way of thinking can be justified from hoaxes to challenge each other. Even the health workers are suspected. The spread of fake news from public opinion leads to upheaval in society, the uncertainty of information, and create mass fear. News based on fact needs to be strengthened by the government. The various communication channels that exist must be filled with accurate, actual data and facts, and one voice in comparing information to any existing phenomena. So it is important to select the information received to ensure that misunderstandings not occur. The conclusion of the study, it found that 36.2% of respondents refuse health workers due to the misinformation. The second conclusion is the higher of the education, the more difficult it is to be affected by hoax information. And the last conclusion is the media has an impact on one's judgment, where TV and radio are the source of the most reliable information. As the recommendation of the study for policymakers, they should disseminate and educate on information literacy or digital literacy to improve the community's information evaluation skills. The local government must involve someone who understands the situation better or whom the community can trust. For further research, the result of this study can be used as information on the pattern of public acceptance during the pandemic, so that if another pandemic occurs, the public rejection of government policies can be anticipated. That's the presentation. Thank you.